Today's patient is somebody that we've seen before, and she has pretty severe rheumatoid arthritis, and it's a devastating disease. In her case, it's affecting her feet and her hands pretty badly, and you'll be able to see what it can do to deform a foot or a hand. And on both feet, she had surgery prior to coming to me, and I've included some x-rays so you can see what those were. But she continues to have painful lesions on the bottoms of her feet, and her feet are just really deformed. So she's a lovely lady, and I hope you enjoy the video. We have done videos on your feet before, and I'll see if I can find them and we can link to them. But
all right.
Just for those who haven't seen your videos, the deformity of the little toes and especially this big one here, you have rheumatoid arthritis, correct?
I do.
Okay.
For many years.
And so these joints right here oftentimes get so arthritic that you have to take out the heads of the bones there.
I've had that.
Which has been done, yeah. And then on your other foot, this toe is fused and can't move anywhere. Also because of that rheumatoid arthritis. Okay. Okay, so we'll get your nails done, and then this callus on the bottom.
And if you think we need to take off any of the callus developing on the bone there?
Yeah, we can. It's not very thick, so probably I'll just do it with the sander a little bit.
Okay.
But yeah, we'll kind of trim all that. Okay, so your year's been good so far?
Yes, well, yes. You know what, I mean, kind of status quo, number of health things. Actually, tomorrow I'm going to the U for pulmonary hypertension, right heart catheterization thing.
Okay.
But, you know, status quo compared to a lot of other people, status quo.
It's not a bad thing, yeah.
Not a bad thing at all.
Right. Maybe nothing really good, but also nothing really bad.
I know,
Yeah.
I know. We have to be grateful. Still upright.
Yeah. What did someone say? Any day this side of the grass is a good one?
You got it. Or not in the hospital.
That too, yeah. Do you have any plans to go away in the winter?
No, I think I'm pretty happy not traveling, especially during the winter. But we have a lot of things going on in our building, and lunches out with friends, and plays and all, so there's a lot to do here.
So you stay really busy.
I do. Because Ollie, Zoom classes, you know, with
Oh, yes, I do, at the University of Minnesota.
Right.
It's a lifelong learning.
Yep, you got it.
I have some friends who are doing a bunch of those courses.
Oh, okay, instructing?
No, taking. Yeah, one of my best friends, she takes a lot of literature courses.
Oh, yes.
And she's doing one now that is called something like Books for People Who Are Too Busy or something.
Too busy to read.
Yeah, and so it's like everybody gets assigned a book, and then they come in every week and someone does like a book report about the book they read.
Oh, they've got so many different options. I got kind of carried away with the spring quarter.
Yeah, what are you taking?
Oh, my God. Well, one favorite instructor is J.B. Anderson, who does a lot of he's a professor at the U who specializes in presidents. He's more of a historical researcher.
Okay.
Did a lot. He started the Hubert Humphrey Museum at the U. But
just for anybody who's listening, in Minnesota we tend to talk about the University of Minnesota as the U. Okay, so go ahead.
I bet every state does that, but yeah. So, and another series, I think it'll be a 6-week series of different professors, researchers from the U talking about different topics. Then kind of some fun things, Tibetan healing thing. I think that's a 1-session course.
Tibetan healing?
Yeah.
Like with sound healing?
Yeah,
or?
yeah, you got it.
Oh, that's exciting.
Yeah, something different.
Mm-hmm.
But, right now, Zoom classes are better for me.
Mm-hmm. Yeah, and a lot of them now, from what I understand, are in person. After,
They are.
After
They
the
start,
pandemic.
I think they said about half now.
Okay. Yeah, but you're still doing the Zoom
classes,
ones.
Yeah.
Okay. Yeah, I would imagine it's kind of hard for you to get around.
It is, and winters are really iffy. A lot of times, parking at the U
It's horrible.
Terrible.
But they do them elsewhere besides at the university,
They
right?
do, but usually there's smaller parking lots.
Okay.
So, and if there's anything in the city, senior centers or condo complexes, then you've got to park on the street. And
do you have a handicap permit?
I do.
Oh, okay.
I
Just wanted to be sure.
And actually, my current one expires at the end of April, so I've got an appointment at my clinic
Okay.
to see my primary, mainly just to get the paperwork done for a renewal.
Okay.
But that does help.
Yeah.
When there are any available.
Exactly. Okay. Actually, instead of the high-speed drill, I think I'm just going to use this, and we'll kind of file it down a little bit. It really isn't thick at all, and I don't want to make you bleed. So.
No, we
okay.
don't need to bleed.
All right. Let's just clean off all the nail crumbs, and then we'll take care of the callus on the bottom here.
Oh, okay.
Now, with somebody who has pretty severe rheumatoid arthritis, it's not just the feet, it's also your hands.
Right.
Would you be comfortable if we just showed what your hands look like? Okay.
And it's ulnar drift.
Yeah. So, show the camera.
Ah!
Yeah. And are you able to straighten your fingers out?
No, not with help. This
Okay.
is about it.
All right. So that is what severe rheumatoid arthritis can look like.
Yeah.
Okay.
Especially ulnar drift.
Yeah.
Not everybody with rheumatoid, looks like this.
Right.
But yeah, that ulnar bone right there.
The ulna. Yeah.
I got the bundle package.
Yeah. I'm just going to go real gently, let me know if it hurts too much. Now, we had talked about getting rid of the prominent bone that's sitting right underneath here, and we put that off for a while.
Yes. Yes, until the warmer weather.
Okay. And this is being filmed in February in Minnesota.
Okay.
So, warmer weather, we'll have to wait a few months. Okay.
And I guess we have to go to North Memorial for that.
To the hospital? Was there a reason we couldn't do it at the surgery center? Okay.
With the pulmonary and everything,
okay.
They didn't want to sedate me there.
Okay, I understand. Yeah, it's definitely something that we can do at the hospital as an outpatient.
We were almost there on the day before they decided no.
Okay. That was the deal.
The anesthesiologist.
Yeah, and they have the final say on that.
Yeah.
But yeah, we definitely can get it done at the hospital as an outpatient. Okay, so we're going to get as much of this core out here as we can. All right. So that'll be more comfortable to walk on.
Oh, good.
And let's go over to this one.
Yeah. And how does the heel look?
The heel, it's more diffuse.
Okay.
And not as thick and localized as these two, but I can trim that one down as well.
Are you going somewhere now for a trip?
I leave Monday. I'm going to Norway
Oh, how
on a
exciting.
photography trip to shoot
Yes.
the Northern Lights.
Oh,
Yeah, it's definitely a bucket list trip.
Oh, yes. Have you ever seen them?
Well, here last spring
Okay.
we got to see him, so in a way it
all right.
almost feels anticlimactic,
Yes.
but it's going to be so much
good.
different.
So much better than
You know, and completely understanding we could get there and it could be overcast the whole week.
Yeah, yeah.
You know,
Take a chance.
so we can't control it, but it will still be Norway.
Yeah. And the fjords and all
Not
of
gonna,
the,
yeah, not
no?
gonna see a ton of that. We're
Okay.
really going on this trip. It is specifically a photography trip, yeah.
Okay.
So we're gonna be in the Lofoten Islands,
Oh, okay.
which are kind of halfway up the coast. Around the Arctic Circle.
Okay. Yeah. Well,
Very
you're
picturesque
gonna
little.
take layers. If we think Minnesota
Oh, yeah,
weather's cold.
Well, no, the truth is, I've been watching the weather where we're gonna be, and it's warmer there than it is here right now.
Geez.
But the thing is the wind.
Yeah.
So yeah, pretty much we all have the clothing we need, and just had to make sure that we have some, like a Gore-Tex outer layer
Sure.
to break the wind. So.
And oh boy. Oh yes. Lost my train of thought here, but are they at this time of the year, are they on very short days?
They have
or
about
longer days?
Yeah, I looked it up online and it said this time of year, which is going to be toward the end of February, they have about 8 hours of light.
All right.
So we're going to get out and do some shooting around these very cute little fishing villages.
Oh, nice.
And yeah, like that. So, all right, well, let's get some lotion on here.
Okay.
And thank you for letting us video
No
again.
problem. My beautiful feet.
Yeah. And thank you for, you know, talking about the rheumatoid.
Yes.
And, okay. So, all right.
It's definitely the uninvited guest that's with you all the time.
Absolutely, yeah, absolutely. All right,